but we'll use it anyways. Thank you all for coming, and thank you for attending. Elliot Kohn from Comprehensive Rehab Consultants. We are a national physiatry group servicing facilities across the country. And we appreciate you guys coming in on a Tuesday morning, but even more so these four wonderful, oh wow, sorry. These four gentlemen here that are sitting on my left. We're here to talk about strategy. And I don't know about you, but when you think of the word or the role of strategy or chief strategy officer or anything in strategic initiatives, it can be a very vague topic, but also can be very specific. And for these gentlemen sitting here and myself, and some of you sitting in the crowd, it really is a full encompassing role and opportunity to truly change patient outcomes, employee outcomes, and it really makes a big difference in the world. So I want to start by introducing each of our panelists here. Before I do, I truly want to recognize, especially the four of you, for traveling from across the country to be here. It truly means a lot. I know each of you personally and intimately, and I truly appreciate you guys coming out. It's not going unnoticed, so thank you. To my left, we have Jess Dalton. Jess is the Chief Strategy Officer and President for Larry H. Miller and Advanced Healthcare. Jess previously was with the Ensign Group as the VP of Strategic Initiatives, who's probably, are they the largest, Ensign?
Just depends who you ask.
There you go. Well, if you're asking me, they're the largest. I've known Jess for 2.5 years now, and it truly has been an honor to get to know him and understand what he cares about, why he cares about it, and what he does to actually do something about it. Larry H. Miller Advanced, they operate 28 transitional care skilled nursing facilities spanning from California all the way to Pennsylvania. They're based in Salt Lake City, Utah. And especially for Jess to be here, you've been traveling for the last 9 days, so 10 days, and haven't been home since for a little bit of time, so we appreciate that. Tell Annie I say thank you. And you know, what Advanced Larry H. Miller does, their facilities are very tailored, very specific, very much into the short-term care and how they do certain things, why they do certain things. And to have you here and share with us what you are doing and what your organization is doing is truly an honor. So whether the crowd has 10, 100, 1,000, you're all here to gain something. So again, Jess, thank you for coming. Right next to Jess, we have the wonderful Austin Steele. Yes, that is his real name. It is not a stage name. We'll start by, first of all, congratulating Austin. Just got engaged. Woo-woo. So congratulations. Austin is the Chief Strategy Officer for Journey. Journey has gone from 0 facilities to 22 in 12 months? Wow. 12 months. Austin was previously with American Senior Companies. If you're familiar, they operate over 100 facilities in the state of Indiana. Austin came down from Indianapolis, so again, we appreciate it. I've known Austin for 5 years now, and it truly has been an honor to get to know you and understand and starting to work with you and your team. What Journey does a little bit differently and what they do so freaking well is culture. When you have in facilities, if everyone here obviously is somewhat within our healthcare space, there is a lot of turnover. There's a lot of changes. There's a lot of restructuring, especially with acquisitions. And if you haven't followed Journey on LinkedIn, you're losing out. It really is an honor to see what they do and how they take care of their team and their organization. And again, thank you for coming. We have Ron McGaughy from HMG Healthcare based out in Texas. They operate about 39 facilities in Texas. 34? Yeah, give or take. I've known Ron for 2 years now as well, about 1.5 years. At CRC, we service some of their facilities. I actually had the privilege of meeting him at THCA. We got to know each other quite well. HMG has been an established organization across across the industry for a while. If you know Ron, if you know HMG, you know that the entire organization respects that man sitting right there. And that's because of, again, who you are, what you do for your team, how you're able to establish who yourself is, and it makes a difference to the patients. Texas, if any of you are familiar, is a very large state, and their facilities span all across it. So again, flying in from Houston, we appreciate you. Thank you for being here. And then on the far end there, we have Josh Crisp. Josh is a newer friend, but a friend nonetheless. Josh is the CEO of Salinity. Salinity does marketing consulting, operations consulting, and as of recently, it just acquired 8 new facilities, skilled assisted living and memory care in 2 states. So congratulations on that. Josh also is the co-host and co-founder of Bridge the Gap podcast. Again, if you're in the space, you might have seen Austin's episode a while back. But Bridge the Gap truly is an amazing podcast. If you haven't got a chance to listen to it, do it. Because you have the opportunity of speaking to some of the most profound individuals across the state, new person every single week. I saw Josh at the Nick last week in Austin, and he had 11 podcasts recording back to back to back. So it truly gives a lot of insight and opportunity into the world. So Josh, thank you for flying in from Knoxville. I know it's not easy, but again, appreciate you being here. Anybody want to add to what my whole pitch fest for you? Or?
Well, I mean, without you being the connector of just amazing individuals, none of this is possible. So definitely want to give you your flowers and roses and all that good stuff and tell you we appreciate you as well. And
thank you.
I'm taking you everywhere to introduce me. That sounds so interesting.
Well, thank you. I really do appreciate it. So we're here to talk about strategy, what it means. Shout out to Aviva, Bassi, and the Polaris team for making this NAB certified. So for all of you that need CEUs, you're getting them. So thank you to them. There's one primary thought that comes to my mind all the time, and I'd like to give an opportunity to each of you to talk about it. Our healthcare world is robust, it is complicated, it is complex, and it is still beautiful at the same time. There are a lot of things that need to be adjusted and fixed and paid attention to, and sometimes there really isn't enough resources or enough opportunities to fix certain things. But I would be remiss sitting on stage with 4 individuals that have so much ability and power and responsibility. I'd like to ask a question to each of you of if there was one thing in the healthcare space that you can fix, even if it's totally impossible, what would that be and why? Go ahead, Jess. Remember, if you don't know the answer, you just pass it to Austin.
I'm going to make up an answer right here on the spot. No, thanks for the question. How do I say this? Maybe I can just share briefly what took me from Ensign to the Larry H. Miller Senior Health Team. As a lifer with Ensign, I never saw myself going anywhere else. And yet, when I sat down with Joe Walker and Gail Miller, it's a family office and heavily capitalized, an incredible virtuous cycle-oriented organization. The difference for me was the commitment to a 100-year plan. And so when you think about strategy from the lens of short-term strategy, midterm, and long-term, my role is a role that requires me to look at things with a 100-year capitalized plan in place to have a generational impact in senior care and in senior lives. And as I sat and listened to the rationale behind this and thought, now how can an organization truly establish? I mean, we have some incredible organizations in the United States that have done a great job. The Good Samaritan Society has been around providing skilled services for over 100 years. The Eliza Bryant Village in Ohio, until it closed down in 2022, was, I think, 125 years old. These long-term, strategic, patient capital investment opportunities are, I think, fewer and far between. And so what I would change would be this. I would temper the tendency to always achieve short-term gains in long-term care. I think that if we look at the meta-analysis and the broad, big themes, economic, environmental, industrial, demographic themes of our country, one of the biggest themes that we're all very well aware of is the theme of, one, the boomers and the aging population in the United States that has been promised so much, and yet I think the writing is on the wall that we may fall short of those promises. And then secondly, we have an incredible theme of wealth transfer that will take shape over the next 10, 20, and 30 years. And that transfer of the nation's largest nest egg of wealth is going to be significant. And it will tell the story of our generation for generations to come. So I would say that. I would say in a well-capitalized, in a almost a little bit of a skilled nursing gold rush, there's a tendency to want to get in and get out quick. And I think for me, what I would change is be in it for the long haul and have a strategic plan and commitment for 100 years.
I can testify on that. I've, again, had the privilege of spending some time with you and your leadership team in Salt Lake and in some other venues as well. And that truly is something that Joe and Andy and your entire team pushes and structures. So thank you. It's definitely a different picture. Go ahead, Austin.
I'm not following that. No, in all seriousness, I think it's amazing. I think, organizationally, we probably share some similar values from that standpoint of kind of looking at it long term. It struck me when you started talking about your 100 years that I was like, he's creating strategy for when he's dead, But as I thought about it, I was like, okay, I understand like where they're going, and what I think about if I could just. I don't know that it's realistic right now, but I think we're starting to scratch the surface of it, of really taking healthcare and changing it to very much an outcome-based approach. What does that look like is a challenge, because you have states that do things differently. You have a federal government that does things different than the states. You have these insurance companies who believe they do it better than either of the other two. And so I think as we start to, grow, and, specifically we operate in the nursing home space, an ISNP plan that maybe, you own and operate, or you partner with other like-minded, organizations, you start really focusing a little bit more on outcomes than the current, kind of fee-for-service model. I think that transparently, a fee-for-service model does just kind of encourage us to create these different billing cycles or different entities that might bill. So it's a little bit of a challenge. It's maybe a little, far-fetched and outlandish, but I really do think that, as we look at where we go, if we could create a model that's really, outcome-based, I think that we could really get everybody moving in the right direction, specifically as you look at the entire care continuum.
Thank you, Austin. It's complicated, especially because of how Journey operates here in 5 states now?
Yeah.
So.
Yeah, different regulatory, complexities obviously within the different states, and even if we thought about transitioning to an outcome base, we're talking about a 100-year plan to make that work from a regulatory standpoint.
Thank you. Go ahead, Ron.
So for me, I think the idea of what has happened over the last, I would say, 10 to 15 years in our profession, and I'm just talking about healthcare in general, fundamentally, we got things right. What we wanted to do was provide exceptional care for our patient population, right? We wanted to make it affordable, we wanted to make it transparent, and we wanted to make sure that providers were rewarded for being good players in that care continuum. Where we've gotten it wrong, in my opinion, is we incentivize everybody from a different perspective. And because we incentivize everybody differently, it causes a natural friction between all of the organizations. So we're getting to a place now where everybody is, I guess, patient-driven. PDPM is very similar to a DRG, which is very similar to PM, so you have all of the different models that are now starting to be more congruent, so everybody is being motivated and paid in a similar fashion, but where the rubber meets the road right now is our insurance entities. And if you're an insurance provider here, I want to apologize ahead of time, but I just really do believe that the way that insurance providers are incentivized really is at the mercy of people like us, the providers. And because of that, it's going to continue to create this massive friction of patients not getting ultimately what they deserve at this wonderful age that they've earned in their lives, to create a balance and really find value in the care that they truly have already paid into. So what we have to do fundamentally, and if I could change the world, that would be step number one, is to really incentivize everybody to be on the same page and really work toward one common goal of everybody benefiting and creating the same type of environment. Because to be honest with you, if a patient is in a hospital for 10 days, they've already been paid by the managed care company. They have no desire to get that patient out in day 5. If there's no incentive for them to, there's no penalty. There's really nothing there that really says, okay, we're all working toward one common goal, right? If that patient returns to acute, I mean, you could put them in observation. I'm not going to give you an approval for an admission because, hey, let's put that patient in observation. We're going to pay a fraction of the cost for that patient population, and it's going to create something that's really negative. Instead of it being this idea of all of us coming to one common place and working toward getting patients better and really providing the services and the communal needs. The only other aspect of that we kind of glance over is mental health. Our mental health system right now is definitely failing a good majority of our population. And if we don't take the time to really address that in a way that's meaningful, we're going to see even bigger deficits within our hospital systems. So.
Yeah, you had the magic wand. There you go.
Yeah.
Josh, before Josh answers, I actually do want to recognize Josh is usually the one that's moderating panels and moderating conversations. So the fact to have you here to actually answer the questions, appreciate that.
Yeah, well, it's great. Thanks for the opportunity. I've been a developer, owner, operator for 20 years, and most people think I just podcast and sit around and drink coffee in my pajamas. So it's good.
That's not what you do?
Well, it would be a dream job for sure. But so I would agree with what you guys say. To give you some context, so I'm in the private pay senior living space, assisted living and memory care predominantly. And with the acuity creep that we've had since 2008, which you all have been doing this a while, you remember a lot of the acuity got pushed out of long-term care as we know it. And our space in senior living was not ready for that. And what we noticed too during that is that the care coordination and care transitions between different providers and different healthcare delivery services really gets lost on the aging population, whether that's going from home to the hospital, whether that's through transitional care, whether that's through rehab, skilled nursing, back to assisted living. There's so many different providers that, as you mentioned, are all incentivized in certain ways that are probably not outcome-based, to piggyback on you, Austin, that absolutely, that we just see that a lot of things are being prescribed or done that are counterproductive, and no one's really taken ownership of that what we call our resident or patient's healthcare delivery. So in our business, we're not licensed state to state to actually provide a lot of health care, but we coordinate a lot of it. And so one of our strategies is to really begin to own the coordination of that, no matter where they're coming from, and do that through interdisciplinary teams and different things like that. But if I could just simply answer the question that you originally posed, Elliot, is I do think that the coordination of healthcare among different care settings has to get a lot better in order for outcomes to be better.
It's the only way to do it, but one step at a time. I appreciate that, Josh. Thank you. All right. So, like I said before, you guys are all getting your CEU. So there's a certain, objectives that we wanted to talk about one step at a time. Although all these gentlemen here have really fancy titles, none of these gentlemen here actually care about their titles. There are large organizations that require a lot of different moving pieces, yet each of you are very directly involved on a day-to-day basis of working with your teams on the ground, working with your patients. So one of the topics I would like to kind of hear from each of you is strategic initiatives, right? Each day you guys are deeply involved in shaping the care and the delivery at scale, because there's only so much that can happen in a boardroom, there's only so much that can happen in executive leadership meetings, but ultimately, what does that actually translate to? And how do you do that? So I'd like to hear from each of you one initiative, whether it's redesigning the discharge process, care integration, outreach to underserved populations, that has shown measurable results in your facilities. And it'll be interesting to hear from each of you different, again, dynamics, perspective, states, cultures. We'd kind of like to hear from you, Jess.
Wow. One strategy.
Again, if you don't know, you could just pass to Austin.
It's good. It's a very good question. I would say from a strategic lens, we are beholden to those that fund and reimburse, and the regulatory entities as well that really provide us oversight and create a framework, right, for operational excellence. And I think that one of the strategies that we have been really, probably singularly focused on, and Ellie mentioned that we have transitional rehab centers. We also have home health and hospice agencies that support those centers in each of the markets. We have AL and IL, and also the start of a traditional senior long-term care line of business. We've got international staffing and some real estate holdings as well that help us to stay focused on patient care and patient experience. And I think that for us, our singular strategy is, what does that experience look like? And how can we do so within a framework that the federal government will recognize, appreciate, and provide assurances within? And that framework for us is the value-based enterprise. We cannot own all lines of business. We can't own all lines of business in all of the markets in which we operate. We don't intend to. We recognize that competition is poison in our industry. Competition is driving us to fight with each other in such a way that we're willing to sign really, really horrible managed care contracts. We're willing to sacrifice our children in order to be at the table with a hospital or healthcare system, so that we're there alone and we're with them singularly as their only preferred partner. We want exclusivity in our sector. These things are all very normal. Like, this is part of, I think, something that's a good quality that we possess, but when we take it to an extreme, it can be very, very detrimental to our sector in general. And so what we are doing within the construct of CMS's value-based enterprise framework, one, there's a care coordination value-based enterprise framework, and two, there is a risk share payment-based value-based enterprise. We're focusing specifically on the care coordination value-based enterprise. We've coordinated that care and are leveraging the full continuum of services that we offer and own in the markets in which we operate. And in those areas where we have gaps in the continuum of services for senior care, we are partnering with external facilities and other skilled nursing providers and other operators as value-based partners in a value-based enterprise model so that we can be better together and really curtail the challenges that come with cutthroat competition. So.
That's amazing, actually. You would never think to go to your partner down the block and say, hey, do you want this patient?
Well, listen, when I was in AIT and my first building that I received as an ensign administrator, it was down the street from an advanced healthcare building. And I had 110 beds to fill. I had 60 beds that were filled, and I had the remainder that I needed to fill. And I went as a traditional long-term care operator to an advanced healthcare building, and I said, hey, you're a short-term skilled patient-focused entity. You're denying patients that could potentially roll long-term. Send them all my way. And as competitors, we served the community, and it was magical.
It's amazing, actually. Cool, thank you for that. Austin.
Yeah, I think, my approach is maybe a little bit more simplistic as we've kind of started Journey and built Journey. As you alluded to earlier, we've really been doing this for about a year, so we're pros. But
You are. Journey is still in its infancy, but
no.
don't sell yourself so short.
Yeah, but really, we look at it. We operate in 5 states. That can be challenging. We have 22 communities. You do the math. Call it. Just to make the math easy. 4 buildings in a state. It doesn't quite break out that way, but you get the point. You want to be pulled apart, and even though we're in multi-state, a big initiative for us is that we want kind of this local leadership team that's on the ground in these markets that we serve. I live in Indiana, and we just feel like, hey, we can't run these completely from Noble, Tucky, Indiana, which is where we're from, and so we have local leadership. When I say local leadership, obviously within the buildings, but we build out a robust leadership team, from a regional level that's probably more heavily invested into than a lot of companies do, because we feel that, that allows us to, when you talk about the culture that we have within our organization, that allows us to grow that culture even though we're spread out. It allows us to be able to talk to those, key leaders and make sure that everybody's on the same page. Because if we didn't have that local, regional leadership team, we might miss things. We might think that, oh, this is how it really runs, and they may tell us no. And, Kentucky, it's a little bit different than it is in Georgia, which is very true. I mean, it's a completely different market. The way that they discharge people out of the hospitals, et cetera, is completely different. So we have to curtail how we're approaching our care, that's related to that. And we fundamentally believe in culture within our organization, which I know is hard to see when you're looking at an ROI and trying to find the line item that says culture, and what that impacts to your organization. But in a year we've seen great ROI. We've seen we've grown, I think, 8% on our census. We've grown 250% on the skilled side. We've achieved 2 deficiency-free surveys. We've got quality award winners. I mean, we're really seeing the fruit to our labor. We don't have any agency in our buildings. And at the end of the day, we just believe that fundamentally happy staff get better care. And that's kind of what we're after.
It's what you see. What you're saying right now is truly what you guys put out there. So that's, well, thank you.
Thanks.
Ron, I've seen you personally in action doing certain things, so I'm curious to hear which one you pick out.
So if I were to pick one strategy, it's the acceptance of technology, right? Our profession in general has really been resistant to change. How long did it take us to absorb the idea of not writing in a chart, right? Like that was a big to-do for us, for a number of us as operators in this profession. What we did specifically, though, and what I really am very proud of, is we decided to take technology and use it as a tool to make people's day easier. We wanted to give people time back in their day. I would ask all of you, as you're operating your various facilities and various entities, that you really consider the idea of giving people time back in their day. That is a very powerful statement. And the reason that it's powerful is because you want to look at tools, strategies, and systems that really allow people to do ultimately their job. So one of the things that we did from a strategy standpoint is we looked at a tool that would give us information about patients that may have been with us in the past, that were a part of our care continuum. They may present it to the hospital, and we utilize that tool to recapture those patients back into our system. It's a great tool to utilize. I know a number of people that utilize it to this day.
What's it called?
Sorry.
What's it called?
It's called Bamboo Health now. I think at the time it was called Patient Ping. But what we started to identify is we started to dig into, and I believe in this idea of majoring in the minors. So if you major in the minor details, everything else kind of works itself out. So what we started to do is we were looking at this information. We were noticing that a lot of these patients were attributed to ACOs or primary care physicians and different tools like that. So we started to take that information and say, well, why are we waiting for this tool to tell us that these patients are available? We actually started to develop those key relationships with those ACOs and looking at those as opportunities to find additional volume. We've been able to increase our bottom line specifically just by creating these relationships where patients are no longer having to present themselves at acute. We're actually getting these patients now from the community because these patients are full risk. They control the money. They know where the money's going, and they want to partner with us because we are considered one of the most cost-effective tools to get their patients healthy again. And so because we created those alliances, it's really helped us drive census. It's helped us drive more community efforts. After they leave our setting, because now we have a provider and an ACO that we can go to and say, okay, not only are you, is this patient ready to go home, but they also have all of the needs being met in the community. So that has been a huge saver for us, and we've increased revenue over the last 3 years that we've been tracking it, specifically just from our ACO relationships. We've increased about $2 million each year over the last 3 years in really finding those additional patients and creating that environment of transparency. So it's been good.
So for us, over the last 6 years, we've done something that it sounds super elementary. It's really simple concept, but it requires a pretty heavy lift and commitment to execute. And what we call that is a simple family care meeting. So for every single one of our residents, we have a quarterly family care meeting. And that does consist of an interdisciplinary team that is standard interdisciplinary team, but it goes further than that in that we bring in every department director. So life enrichment and activities, dining, housekeeping services, and so forth. And we take a total look at everything that's happening with that resident during that time period. Every transition, every medication, every meal, every activity, every interaction with staff. And from that, the patient or the resident's representative is in there. And we look at that not only from a quality outcome standpoint, but as a way to incentivize our team. One of the things that I learned early in my career is that all of our policy is really useless without our team implementing it, right? And them really buying into it. And I also learned that if they don't get rewarded for it, it's probably not going to get done. And so those basic, very simple leadership principles and management principles we use to actually give an outcome for our team, to incentivize them on the good outcomes of what is happening with that resident and the care delivery system within our communities. And so from a business standpoint, from a revenue standpoint, it's also helped us over the last 6 years, which is really about as long as we've been tracking it. One of our key metrics is average length of stay has gone up 2 months, which has been great. Our employee turnover, which is a huge thing, has gone down 15 basis points, and that's been in the last 6 years. In case you all have forgotten, that's been pretty tough years for labor and turnover. So we are really proud of that, and several other statistics that ultimately go to the bottom line, and I think that's helped our culture and our team recognize that ultimately what every single person that touches anything to do with that resident, whether it's something as simple as an activity program, a meal delivery, a housekeeping service, or healthcare coordination, that everyone is committed to the quality outcomes of that resident. And so that's been really helpful for us, and we hope that we'll just continue to see those numbers improve.
Well, thank you, Josh. Yeah, it's usually the hard parts at some points, which sometimes can make it a little bit more complicated. There's the second kind of piece, and I know that Jess actually kind of talked on this, but specifically partnership building, cross-department alignment strategies. I think that there's, especially operating, again, large organizations, multiple different locations. We talked about, Josh, you just mentioned about kind of things getting kind of stuck in silos and not being able to expand on what actually those initiatives are or how they're done. And I kind of want to hear from each of you in regards to, there's also sustainable improvements that rely on partnerships. And Jess, like I was mentioning, you talked about working with your competitors. And competition can be fierce, and you probably all compete in similar markets, I imagine. But there's a way to do that in a way that's helpful ultimately in what we put first, and I think each of you have touched on the points of patient care and patient outcomes. So would like to hear certain sustainable partnerships, not just externally, but also across departments internally. There's executive leadership conversations that happen, but yet it doesn't necessarily translate into what's happening on a day-to-day basis. So would like to hear some of those specific aspects of things that each of you have done in your organization to kind of kick it a little bit in the butt to get things moving. So go ahead, Jess.
Yeah, I think that there's, a theme relative to value-based relationships and experiences. And of course, the federal government's got a very strategic timeline and time frame and some ideas around how that looks. And we're seeing, right, mandatory bundles and so forth from a reimbursement lens. As we look at our operations from a value-based enterprise lens, we tend to look more at service bundling and the opportunities that we have to bundle our services in a highly coordinated fashion such that it becomes a nice boxed and wrapped bow gift to the families and residents we care for. If we can help remove and reduce the complexity of care and of multiple care settings through a highly coordinated enterprise that's focused on outcomes-based metrics, that's focused on clinical excellence, and clinical being both therapy and nursing, right? We call it a one clinical approach, including case management, right? These things, if we look at everything, and as we do look at everything that we are engaged in as a bundle, one, it will help us to not be a commodity in a very competitive sector and in a larger healthcare ecosystem. The last thing that we want to be is a commodity for hospitals and for providers to use and abuse and discard when they need. We're not fast fashion, right? We are committed long-term care, and that's how we want to be seen. And so in order to do that, I think that as we approach things from a bundling perspective, we can sell the bundles, for lack of a better word, to payers and plans. We can bundle our services with the services of others so that we have breadth and scope and buying power so that we don't have to accept the rates that are placed in front of us from payers and plans. And we can actually be a competitive force contractually in shared risk, in up and downside, in shared savings, and even in long-term care planning that oftentimes advantages those Medicare Advantage plans more than they do the operators that house those patients.
So I have such a follow-up question on that, Jess. So obviously, Advanced Larry H. Miller has a care continuum, right? You have all the different factors. Do you find that, I guess it's a two-part question, do you find that it's obviously easier, you were talking about discussions with hospital systems and not being used and abused. I would imagine, well, it's not a question, it's more of a statement, but it's easier to negotiate with organizations and say, hey, I'm not just taking care of them for the 15 days when they're in my facility, I'm taking care of them for X amount of days when they go home.
Yeah.
And it makes your life a little bit easier. My question is, do you recommend, there's a lot of different organizations that have ancillary services that they partner with, that they work with specifically. What's your kind of recommendation on other organizations and either getting involved with partnerships, not necessarily ownership, but specific partnerships with ancillary providers, whether it be home health, hospice, physician services, wound care services? I mean, we can keep going, but do you find that to be a benefit to an organization, or can it also be somewhat convoluted? And on that question too, it's, sometimes I speak to a lot of different providers and they say, well, I do one thing well and I want to just do that and focus on that, right? Or I do long-term care well, I don't care about home health, I don't understand it. How, you guys at Advanced, and even when you were previously at Ensign, do you find that to be, would you recommend something like that, or can it sometimes take your eye off the prize?
Yeah, it's a good question. I mean, I was going to say, as long as it's not a distraction and as long as it's not noise, right? And in order for that to be possible for us, when we look at the continuum and the ecosystem that we're trying to create and be a part of, longitudinal episodic is key. If we are unsuccessful in the minute by minute, it's a sign that we just need to broaden and back away and lengthen the arc of time in which we're caring for these individuals. And we do that in a way that helps to provide a longer term perspective. For our health plan partners and payers and hospital systems, they appreciate that because we're addressing and able to address their pain points from a value-based care and reimbursability standpoint. But I think that everything needs to be, and my approach is, when we start on an initiative or with an initiative or in a new partnership, and you know this because we've done this with CRC, we want to create an intentionality. We want to go in to these partnerships in a very curated and in a very edited way, and we want to make sure that the experience first and foremost is representative of the experience. As partners, we want to make sure that that experience is representative of the experience that we want our patients and residents to have. And so, maybe there's more thoughts here.
I can testify to that one too. But Austin, kind of curious to hear your insight, as there's a lot that you guys do and there's a lot that you guys do well. So
Sure, yeah. I think, for us, unique, in this growth mode of acquisition and what does that mean? And, a lot of payers, as we were going through, some buildings had a managed care contract, some buildings did not. And the more that we were acquiring, the more we found out that basically the payer didn't want to renegotiate with us. They didn't want to be in network. And, they would tell us that, well, you don't meet the criteria and we should have termed the contract, years ago. But they're so big, they don't start realizing that. But then once you start going through the credentialing process of a new, they're like, no, you guys don't meet criteria. And so we went out and we just said, all right, what are we going to do to kind of create a relationship that we could maybe grow our payer relations? So we literally courted Humana. I worked harder at Humana than I did my fiance, But we went, to their office and we told them about Journey. We wanted them to know, like, hey, this is who we are. This is what we believe in. Here's my pass. Here's Matt's pass. Here's Bernie's pass. Here's our CNO. We're meeting there with them, and they were fortunate. They met with us, and then we're trying to kind of learn the Humana web, and there's basically like a Midwest group, president that we had to appease, and then I had to appease the Southeast president. We weren't quite big enough for a national. So we then started having dinner with each of those to talk about, hey, here's where we're going, here's where we're headed. Take a chance on us, even though, oh, look at these guys. These guys are the best.
I won't do mouth to mouth on you, Austin. Sorry.
Yeah, thank you. That was helpful. You could tell I was just like struggling over here. So we started having dinner with them in the different markets. Even to the point we were late to one of our own meetings because we were like, hey, they can meet in Columbus on this day. Let's go there. That night we'll fly, to our other meeting that we were going to have that was, with ownership. But what we did is we formed a relationship. We did not meet their criteria. And they said, hey, we're going to put you in. Here's what we're going to do. We would like for you to come in. We believe in where you're going. We like the outcomes that we're seeing. We did facility tours with these people. We laid out our entire capital plan that we were doing. It was a lot of work, but we were really happy. We ended up with 19 of our 22 buildings to get contracts, specifically with Humana. One of those buildings doesn't even take Medicare, so really, 19 of 21. And the other two, it was fine. Actually, we kind of traded. I was comfortable with those not getting it, so that a couple other buildings could, and one that we acquired was already SFF candidate, but so they didn't get it. But once we come off of SFF, they said that they would happily put us in network. So those are just some of the things that we've done in a short time that is is a little bit different for us, just in trying to court and build a relationship, because I think that the one thing that we do believe in is relationships do matter, even if it's a big national player. We, in a lot of what we do, we just want to have one relationship, even though we're spread out over 5 states, one person to handle this that could do all of it. So it was really fun. It was a lot of work. But it was exciting for where we're at, and we're already seeing the fruit to that.
Well, thank you. My follow-up question to that would have been, courting and spending the time, money, the energy. It takes a lot of effort, and was curious to see if there were any results. Clearly,
yeah, she said yes.
No, not Erin. But that's amazing. And you mentioned a little bit earlier about some of the increases that you guys have done and some of that work and ROI on culture, because there is no line item. But
right.
Relationships do matter, and that the follow-up would have been what your results are, and clearly you're doing pretty damn good. So
yeah.
Congratulations
so
on that.
Thank you.
It's interesting to see. Ron, my friend.
You asked a couple of questions, so I want to make sure I answer which
How
one
about this?
Yeah,
You
yeah.
answer whichever question you want.
So,
I will follow up on it, but
all
go
right,
for it.
no worries. So I think the idea that we could do this in silos is such a misfire. There's no way that we could truly impact what it is that we do, which is human lives, with just a me mentality. And so you have to go into this saying, how are we collectively going to all come together for one common goal, right? And so it's creating those alliances, even though it may be difficult in conversations that you don't want to have. It's creating those cross-functional relationships with other providers that do exactly what you do, because I really do believe that there are enough patients out there for everybody, especially if you're in a CON state. Like you have, there's enough out there for everybody. Texas is a little different. It's more of a wild, wild west, but there are other things that have happened in Texas that are kind of limiting new buildings to be, rectified every other day like it was some years ago, but definitely being able to have that relationship with the care continuum and really having very direct, serious, open dialogue about where you are, what your expectations are, and what you need ultimately leads to better outcomes for everybody involved. I think one of the areas, if I could go back to one more, if we could have this transparency in our staffing. It would be so cool to be able to say, CNA A, who has been in the business for 20 years, but has flipped from facility to facility to facility to facility over the last, 20 years, has never been successful at any of those areas, but we continue to hire these people on and on and on again. To have some type of transparency in those type of environments would be so cool. I would love to be able to, and I do it now. When I hire an executive level staff member, I do ask my friends, hey, do you know so-and-so? And they're like, oh, stay away from that person. Or, hey, that dude stole my bike in high school. So whatever it is, you gotta find, those type of relationships. But being able to do that with your frontline staff, I think leads to better outcomes. We are very limited in our staffing numbers and what we can actually do. There's not a lot of people out there. So finding those opportunities are tough, but we have great partners like Shift Key that help us in times when times are down. But we also do our best to try to find, other opportunities as well, and see where we can really make things work. So,
Well, I was going to say there are some people in this room that I can introduce you to help.
I'm sure they're all willing to help wherever they
But
can.
you already work with them, so that's fun. But
Yeah.
I one follow up when we talk about silos. I've also had the privilege of working with multiple leaders from your organization across multiple parts of the state, and what I've always, and I kind of touched on this in the beginning, what I've always recognized and identified is how you as a leader kind of work with your team. So I'm curious to hear, working with those teams, because I know some of them, there are turnovers, a lot of people moving around. How are you at HMG in your capacity able to truly create this continuum? Because when I met with one of your people, all of a sudden I get a text from you, hey, why are you meeting with Kaylee? Just call me, right? So I'm curious to kind of hear how that flows and how you're able to do that.
I know what I'm about to say is going to shock you guys, but this is take this down. If you have a pad in front of you, write it down. This is going to be good stuff. It's going to be really simple. Listen to your people. Listen to them. Do not absorb or wait to answer. Listen to what they are telling you. They're giving you the information that they need to be successful. If you do that in a way that's impactful and you listen to your people, every year I meet with all of our leaders and I tell them, tell me what's working, tell me what's not working, and give me the reason why, right? Try it. You're going to be shocked at the outcomes that you get. When people truly believe, and the reason that people trust me and the reason that people listen to me is because I'm not here to make you do reports all day. I don't want you to just send me reports for my own personal benefit. I want you to understand the value of why we're doing what we're doing. The why is more important than anything else. If you don't understand the why, you're never going to be successful. So, one, make sure that you're doing that. Listen to your people. On the flip side of that, take what people give you and implement it, and give them credit for all the great ideas that they bring to the table. I hate when people either refer to me as boss or da-da-da. Everybody's my colleague, everybody's my friend. That's just how I've always operated. And the reason that I do that is because I am a shell of myself without the amazing people that are around me. I could name 1 million people that are on the team right now that work harder than me, that are smarter than me, and better than me. But the best part about it is that they work for one common goal, and that's what you want. So if you listen to your people, everything else will work itself out. Your career will be long-lasting, and you'll never have to look for another job again. Okay?
I appreciate that. Go ahead, Josh. That's it sounds so simple, but if it was easy, everybody would do it, right? Josh, hearing from your experiences across and as operations and meeting with all these people across the industry, curious to kind of hear your thoughts on, again, there are multiple questions that were thrown out. You can pick whichever one, or I can steer you in a direction, but I think you probably know what you want to say, don't you?
Yeah, so I will say what I'm hearing, overwhelmingly is integration. There is a lot of traditional senior housing operators, owner-operator groups that are acquiring or spinning up different services that, I think in an effort to move towards the value-based care in that. We're no different, just on a smaller scale. In the last year, we've started integration. That's a strategic initiative of ours. We launched our first home care division. We actually were just in the news about that in Hawaii, of all places, to support our development
Yeah,
there.
strategic, Hawaii.
Yes, it's a great vacation spot as well. But essentially what we're trying to do is, for lack of a better term, geofence around each one of our communities. And we look to initially partner with our preferred providers that we coordinate in all of the services, from pharmacy to home health therapies to mobile images, and you name it, just right down the line. But back to the original comment I made, we're controlling the outcomes. I think a big piece of that is the coordination of it all and someone taking ownership of the outcomes. So as we looked around the space, it didn't seem like anyone was really taking ownership of that, and we couldn't find, okay, how are we going to get reimbursed for this? So we're trying the model in a private pay setting. So within a certain area around each one of our communities, essentially families pay a membership fee, and it's care coordination in the home, the same thing that we would do in the assisted living walls. But with that, we also take in the technology. And so we support the ADLs and things like that, and then coordinate the healthcare. The other thing that helps us with in the private pay senior housing space, depending on which data set you look at, I'm looking at NICMAP's data, we only reach about 9% at best of the age income qualified group out there that needs our services, can afford our services, and that means either we're not doing a really good job at educating, or they don't want what we're offering. And so that's a big piece of our strategic initiative, is when we get those calls from the adult son or daughter that says, hey, I want mom there, but she's just not ready. She wants to stay in her home longer, but I'm having a tough time trying to live in another state and coordinate all this care. How can you help with that? And so we heard that for so many years over and over and over again. And so far, that's really good. The other thing is we've found that when people need care, there's usually a health event of why they decide that they need to come to senior living. And because of regulatory environment, oftentimes it would take a week or two before we could get them into the setting that they needed to be, just because of all the paperwork and the expense with that. And so what this does is getting people onboarded, getting all that required paperwork, getting them in our EHR system and all that at home or wherever setting they are. It allows for a smooth transition into whatever care setting they need, with someone taking the ownership of what all's being coordinated for that resident. So that's kind of what we're doing right now, and how we're dipping our toe in integration.
That's awesome. You can see it, especially as you're taking over new organization, new facilities. It's interesting to see how that integration works. So we're kind of sort of at time. I did want to maybe have the opportunity for some Q&A if there is any, but before I do that, we mentioned also different things, different organizations, different ancillary services, different providers. Ron already gave a plug for ShiftKey, but I did want to just go around quickly if there are any organizations or ancillary providers that you use that you felt have really helped your strategic initiative. And again, you don't need to say CRC because you all use me, so that's fine. That's not dependent on why you guys are here, but curious to kind of hear from each of you if there's any specific organization that has truly helped your organization with your strategic initiatives grow. Go ahead, Jess. Your chance for free plugs. Yeah.
There are so many, man. I would say as we span multiple states, Pennsylvania to California, and we're growing in each of our markets, purchasing partners are pretty important to us right now. Purchasing in every area including the staffing purchasing area and in the supplies and in the, we're developing 6 communities de novo out of the ground, and that's a big important part for us right now. So I'll just keep it broad and vague.
That was a good political answer, my friend.
Okay, broad and vague. Too many to mention, but you know who you are.
Go ahead, Austin.
Yeah, I can give a similar answer without naming specific, vendor partners. But we, as I talked about with building relationships, we really went to, these vendors as we were starting, and we said, hey, like we would love to have, your bottom pricing. I mean, as anybody would, but just being completely transparent, your payment terms matter more to me right now than what your pricing does, because we're going to have to go through a chow process that's going to take time, and we change everybody to weekly pay, and so cash flow, even though on paper we may look great, cash flow is still always your biggest challenge. And so payment terms, a lot of our partners have been a true partner in that, where we said, hey, can we work on these terms? We'll give a little bit on the price potentially, but terms matter. So, and it's been great. And I think people have really appreciated us being upfront and transparent about that on the front side, opposed to hounding us on the back side saying, hey, when you going to pay? And us saying, like, I can write you a check, but it's not going to clear, So.
Well, we've never had this conversation because you don't pay us, so that's a good thing.
Yep.
But I appreciate you sharing that. That's vulnerable and transparent.
Yep.
Thank you, Austin.
I think I burned mine already. So.
Well, I will mention a name specifically. That's probably not the right thing to do, because I'll leave a lot of people out that make it possible for us. So being a small, somewhat regional owner-operator, a lot of the big box partners typically, we don't have a lot of leverage. We don't have a lot of negotiating power. But one of the partners that has been helpful in adapting to mainly help us with the data sets that we need, responsive to some things that we think are innovative that we're trying to do that don't meet the criteria of what maybe the software currently offers, has been really great. So we've got Alice and Medtelligent in our buildings. We've been with them since they first entered the space, and they've been really good to adapt and do things that help our teams be informed on the data that's important to us. And particularly as we're looking to grow and expand and integrate, they've been super helpful for us.
I appreciate that. Any questions? All right, we answered all
This
of
is
them.
what we call management, buddy.
There you go. Well, again, it's truly, thank you all of you for joining. Thank you all of you guys for attending. It's been insightful and far-reaching. So again, appreciate it all. Thank you again. And I think the next panel is starting shortly. So thank you.